Welcome back, everybody, to Hormones and Health. We are bringing you information you likely have not heard from your regular doctor. Our guests are top notch experts talking on how to achieve hormonal balance, increase your energy and focus, and how to hit your ideal weight and feel great in your body, right? Because we all want it. So, today I am very excited to introduce you to Dr. Emily Kiberd. Dr. Emily Kiberd is a chiropractor. She's a mama to Elvis in Brooklyn, and she's the creator of Thyroid Strong, a program for women with Hashimotos to learn how to work out without burnout. She was diagnosed with Hashimotos in 2016 and has put her Hashimotos into remission through changes in her diet, exercise, and lifestyle. And now she helps women do the same. Wow, thank you so much, Dr. Kiberd, for coming in. Let's bring her in. Welcome.
Thanks for having me. So great. So great to be here.
Absolutely. It's great to have you. I cannot wait to learn more about Hashimoto's and autoimmune conditions and how you help women, actually live healthy and be strong. So let's start with your own story. It's a powerful recovery story, and I would love for you to give us a bit of a background.
Yeah. So I've been a chiropractor since 2007, and I had my first baby, which is Elvis, back in 2016. And all those new mom symptoms were present. So exhausted,
Right.
difficulty losing baby weight, my hair was falling out, that brain fog where you start your sentence but you can't finish it. And I would tell my OBGYN, some of my mom friends, when you have a new baby, everything is so new and you're asking yourself, is this normal? Is this normal? And everyone told me, oh yeah, that's normal. Like, of course you have brain fog, of course you're tired, you're not sleeping, you have a new baby. But 18 months later, a year and a half old, and I was still experiencing all those symptoms. And I think being a chiropractor, but just also, being a mom and wanting to show up for her new kiddo, I was like, this cannot be my new norm. Like, I can't live life like this. So I started to kind of go down that doctor trail that a lot of us do. So seeing my primary, seeing an endocrinologist, actually seeing a couple functional medicine doctors, and was doing different supplement protocols, not with like a really clear goal, and wasn't feeling better. So I would crash on the couch at the end of the day. I also run a clinic, was running a team of 10, seeing patients and being a mom. So, probably burning the candle at both ends. And then I met my current functional medicine doctor, Dr. Gabrielle Lyon, and she took a barrage of blood work, way more than what some of the other doctors were taking. The other doctors were only checking TSH, thyroid stimulating hormone, which is a very common conventional medicine approach. But, there's other tests to really get a clear picture of how your thyroid is functioning, as well as is your body attacking your own thyroid or the thyroid hormones circulating in the blood. So she took a lot of blood work, checking inflammatory markers, my thyroid health, amongst other things. And she's like, you have an autoimmune condition. You have elevated thyroid antibodies, both of them. There's two. And it's good that we caught this early, because if you catch it early, you can go into remission, right? About 20% of women with Hashimoto's can go into remission, but you have to catch it before there's too much destruction of your thyroid gland, too much atrophy. She's like, all right, are you on board? And, of course, I'm like kind of brain foggy out of it, but I'm like, yes, like I'm the type of person, you give me a plan and I execute on it. I'm not very wishy-washy in that sense. So she's like, all right, we're going to clean up how you're eating. Like no more gluten, dairy, all the kind of autoimmune paleo triggers that you would remove. So like corn and soy. And then we also went on a low histamine diet, which could be things that you would think would be really quote unquote healthy, but not if your, inflammatory cup is overfloweth. So avocado, spinach, bananas, citrus fruits, those were also taken out. So that was just one piece. Another piece was starting to dig up like, okay, so what are some environmental factors that are triggering this autoimmune condition? I have a family history of thyroid issues with my mom, my sister, but what were some environmental factors? So looking at mold. Found some mold in my apartment. Had to remediate that twice, which is a very big, lengthy, expensive process. And, some parasites from some travel when I was in my 20s. And, it took about 9 months, which I know a lot of women will think, oh my God, 9 months doing the work. But if you think about, okay, well, how long have you actually not been feeling good? Like at least take half of that to start to feel better. Maybe even, if it's 2 years not feeling good, maybe 2 years to start to feel better. And then the last piece, my energy was coming back. My brain fog wasn't so foggy. And the last piece was really changing how I was working out. Because I was really, I was doing a lot of cardio to try and lose a baby weight. I was going to a spinning class for 45 minutes and then walking across the street and doing a HIIT training, like a 45-minute HIIT training. And just really, burning the candle at both ends that was already burning very quickly. And the weight wasn't coming off. So even though the food was dialed in, the environmental factors were starting to get cleared up, I was like, okay, this is not working. And I've always had a background in strength. I think I defaulted to the cardio because I think culturally that's sometimes what we are processed. we're programmed to do. And I worked with a trainer friend of mine who's been a trainer for 22 years, who works in the clinic, Matt Semrick. And he mainly does kettlebells. He can, train other things like barbell, but we just started with kettlebells because it's simple, it's accessible, it's forgiving when you're first learning form. And he's like, let's just do like 20 minutes. It's not going to be crazy. We're going to take long rest breaks, and started to integrate that and just really felt better. Felt like I had more energy. Didn't feel like I had to crash on the couch for 3 days after my workout, which a lot of Hashimoto's women will feel. And the weight started to come off. So I started to really just focus on that. Let go of the HIIT training, let go of the cardio. Being in New York City, you hit your 10,000 steps a day pretty quick. You're like at 20,000 steps, but that's also an important piece. And it's just like the weight started to come off and I felt better in addition to doing the other work. And so I would co-treat in New York with the functional medicine docs. So they would be cleaning up, all the stuff that's going on the inside. And a lot of the autoimmune population has a hard time maintaining their muscle mass. And we can talk about that. And so I would work on the joint pain, the muscle aches that go hand in hand with Hashimoto's, as well as trying to maintain their muscle mass, and just got better results. So a lot of women who would come in wanting to get massaged would want some stretching routine or some foam rolling advice and get adjusted. I was like, we're going to take that out and we're going to give you one thing, and it's going to be resistance training. And of course, at first, they're like, no, like just adjust me and like send me on my way. And I was like, it's such a disservice. So we switched that up with a lot of the autoimmune population we were seeing, and people started to get better and felt better after years of not feeling great, also getting passed around to a bunch of different doctors. So that was kind of where Thyroid Strong came out of, is like, I felt like I was saying the same thing, teaching similar things. I was like, okay, well, obviously more women than just the women in New York need this. How can we get that out there? So it's an online program teaching women how to work out without the burnout, right? Because so many of us work out. We think we have this cultural, ideation of sweating red in a pool of sweat after 15 minutes of like going hard. And could there be a better way? Could working out smarter instead of harder really actually be better for us?
Wow. Okay. So we have a lot to unpack and go into detail. So thank you so much for your story and what you brought up. But I do want to ask you, what actually is Hashimoto's, and can it be cured?
Yeah. So Hashimoto's is an autoimmune condition, and there are 3 components to it. There is an underactive thyroid. So the thyroid gland right in the front of the neck, thyroid hormone, it secretes thyroid hormone, and thyroid hormone is required for every metabolic process in the body. So when our thyroid is underactive or sluggish, things slow down. Like we get constipated, we get bloated, our hair gets really dry and it gets dry and our skin gets kind of ashy and flaky. Our joints will feel crickety, and then the fatigue and difficulty losing weight. So those are all kind of the physical symptoms, the brain fog. There's an underactive thyroid, so which will get picked up on blood work. And then the last piece is that there's a presence of thyroid antibodies. And there's two different antibody tests. One checks for antibodies attacking the actual thyroid gland, and then one checks for antibodies attacking the proteins from the circulating thyroid hormones in the blood. So the antibodies test is also a serum draw. So those are the three components. And most women get diagnosed in their 50s and 60s while they're also going through perimenopause, menopause. But a lot of women can get diagnosed younger. And it often gets missed because a lot of conventional medicine doctors are like, you're not the archetype. You're not obese, right? You're not 50. And so I think, in my journey, and I know a lot of women's journeys of women I work with, it gets missed. And it's such a disservice because if you pick it up early, you can go into remission. So you can't heal Hashimotos, right? Because it's an autoimmune condition. The genetics are there, and then the environment kind of adds to that inflammatory load. But so if you hear someone say like, oh, I reversed Hashimoto's, you didn't reverse it. You still have it, but you can put it into remission, which is blood work is within optimal levels. There's very little or no presence of thyroid antibodies, and you don't have the presence of the symptoms.
Okay, great. So why is it so common in our society? Because it seems like thyroid issues are extremely common, and we would think from what you're saying is that, women just don't get diagnosed because they don't fit that archetype. But it seems like it's actually a much more prevalent disease than we may think.
Yeah, I mean, I think the thyroid gland unto itself is this kind of very delicate gland. And if there's load on the body, then it can, tip that balance. So, and I think, we're just barraged with more environmental factors. So, exposure to mold or mycotoxins, which is way more prevalent than we probably think. Probably like 60% of buildings have some water damage. What our food is sprayed with, any sort of endocrine disruptors, like, drinking out of plastic water bottles, which I know I did as a kid just because, my mom didn't know better. She thought it was better than like the tap water. Any sort of parasitic infection, which is very underdiagnosed in the States, but is very common. And, I think there's just kind of all these things that are barraging the system that either maybe we're not educated on. Like if we educate ourselves, we can make better choices. And yeah.
Okay. Yeah, it makes sense, right? And so if somebody's listening and they're just wondering, well, maybe I actually have it, like what are the red flags? When do you feel like somebody, a person should actually go and check themselves and get the right testing?
Yeah. So I think the two biggest struggles are you're fatigued, but it is beyond like, I need a nap, I'm tired. It is like you're hit by a bus and you just need to nap for like 3 days straight. Like it is, if anyone's ever experienced like that first trimester pregnancy fatigue, it is like that times 10. So just a really, really heavy, intense fatigue. Like some women feel like they can't get out of bed to go to the bathroom. The second one would be just really trouble losing weight. And I mean, like women are doing all the things, like eating well. They might be even counting their calories or tracking their macros. They are resistance training, but if they are not working with a practitioner to manage the thyroid hormones, they will not lose weight. I just was talking to a patient the other day about this, where she had her meds changed. And she was like, it was the only thing that was changed. My eating was good. My workout was the same. And I gained 40 pounds in like 2 months. So that really kind of like uncontrolled weight gain. Usually a telltale sign is you lose the outer third of your eyebrow. and your hair will kind of come out in clumps.
Mm.
Dry skin, like you could moisturize and hydrate, and 20 minutes later you're dry and ashy. And then I
Mm-hmm.
think the last piece is the brain fog, as well as, I should include this one, like intolerance to cold. Like it could be 80 degrees and you feel like you need a jacket and a scarf, and those are all the components of an underactive thyroid. Joint pain, achy muscles.
Mm-hmm.
So, from me, from a biomechanical perspective, as a chiropractor who does rehab, if someone has pain that moves around the body and there's no clear mechanism of injury, like they're like, oh, my shoulder hurts, and then 2 days later, like my wrist feels funky,
Yes.
and then like next week my knee hurts, but they didn't like fall, they didn't trip, they didn't step and turn weird. That signals to me a red flag, like, oh, like something else is going on. And one of the things that needs to get ruled out in that differential diagnosis is, do they have an underlying thyroid condition? Another thing that pops up to mind, especially living in the Northeast, but really all over the country, is like, did they get exposed to Lyme's disease?
Mm-hmm.
So that's, from a biomechanical level of joint pain, muscle aches, moves around the body, no clear mechanism of injury, that to me triggers like, oh, they should go get their a full thyroid panel, including thyroid antibodies.
Okay, right. And you're saying it is important to take the full panel, because if you just test for certain hormones in the thyroid, is not enough. So
Yeah. So even just, the conventional medicine approach is just checking thyroid stimulating hormone, which is like the signal from the brain.
yeah.
And, I've had that many, many a times. And the conventional range is much broader than
Yeah.
a kind of optimal functional range. And, I just saw a patient, I think she was talking about fatigue and joint pain, and that joint pain that moves around the body. She went to her doctor, they checked TSH. Her TSH was like 3.8, and they were like, oh, that's normal. It's like, well, that's actually not an optimal range. And they didn't check any other, of the lab values to get really a clear picture of how her thyroid is truly functioning. So I was like, go back to your doctor. You're going to ask these tests, and some doctors might not want to check those because they'll think your TSH is normal, but like, I ask. And if it's not them, maybe find another doctor that will be a partner in your health.
Yeah. So be an advocate for yourself, and get all the right testing. So let's delve into that, how you help women who have Hashimoto's, because I know it's a complex endeavor too. It's about diet and exercise and actually, changing the lifestyle. So when somebody comes to you and they actually have a confirmed diagnosis and they are, on the journey of putting the Hashimoto's into remission, where do you start?
Yeah, so we start with some really basic movement. With Hashimoto's, that underactive thyroid, that hypothyroid component, it's harder to maintain our muscle mass, to just like keep the meat on the bones.
Okay.
And so you might see someone with Hashimoto's and they have this kind of like doughy appearance, like they don't look like they have a lot of muscle tone. Culturally, it would be called like kind of like a skinny fat. And so we have a hard time maintaining our muscle mass. So I want to get them moving well before I load the muscle. And a lot of women will come and be like, well, I'm doing yoga, I'm doing Pilates, I have like these pink, like 3-pound weights that I'm doing in this dance cardio class. And to stimulate your muscle for muscle hypertrophy, or even just like muscle maintenance, you need two things. You need to be hitting your optimal protein per meal, right? Like a minimum of 30 grams.
Yeah.
To stimulate muscle protein synthesis. And then the next thing is you need to be lifting to fatigue. Fatigue is not that image of like laying in a pool of sweat and you can't get off the ground, but to the point where like the last couple reps, you only have like 2 more reps in the tank, right? So on a scale of like 0 to 10, 10 being there's no way, this perceived exertion, like there's no way I'm going to pick up this weight. And 0 is, oh yeah, I could do like 1,000 of these. You want to hit like a 7 or 8 by the last couple reps. So we get women moving well. And we do it by teaching them how we learned our movement patterns when we were in that first like year and a half of life. And then we start to load these functional compound movements. So a squat, a hinge, a lunge, a push, a pull. You know, squats and lunges are women are very hesitant to do them. And I'll tell you why. It's because with that hypothyroid component, we have slower tendon turnover. So all of our tissues are regenerating, they're replenishing, but because we are hypothyroid, right? It takes us longer to replenish that, especially at the tendons where the muscle inserts into the bone. And the tendons are actually what moves the joints, right? It's a contraction of the muscle, but the muscle pulls the tendon moves the bone. So it's really kind of like the idea, like the tendons move us through the world. And so there's slower tendon turnover. So if you think about that tendon, that infrapatellar tendon that goes across the knee joint, that gets really achy. Like I literally have women, they're like, I don't want to get on the floor to play with my kids or my grandkids because I'm afraid I can't get back up because my knees will hurt so bad. And so, you know, the goal is not to avoid that movement because it's essential. We need to do it. If we don't do it, our tissue will actually atrophy more. But how can you teach someone to do it with good form, slow, controlled, add load eventually, such that when they do it, they're confident. Like I have women who like, oh my God, I forgot that I used to not get on the floor. Like I don't even think about that anymore. So though we start with like getting them moving better, learning the movements, usually body weight at first, but the goal is very quickly to start to load it so that you can get that muscle protein synthesis to get that muscle growth.
Okay, great. So it's really a lot about proper form and a lot about loading. Like it's not about just your pink weights that you're lifting with your fingers.
Yeah.
You actually have to load it up to get to fatigue, which is not exhaustion again,
Right.
but you're actually fatiguing your muscles. So there is true resistance so they can build up.
Yeah.
So I think this is important.
Yeah. I mean, the research shows you could do 1,000 reps with that pink weight.
Yeah, right.
Once you hit fatigue, then you're creating muscle growth. Or you could lift a heavier weight, less reps, probably avoid some overuse, and still get the same stimulation to the muscle tissue. So for me as a mom who needs like efficiency and effectiveness, because I gotta like get back to my kids, I'd rather do a heavier weight, less reps, but then take a long rest break. And that's kind of how like when people lift weights professionally, let's just like that's how they train. They're not doing 20, 30 reps. They're doing, 5 to 12.
Yep.
And it's heavier. They're trying to hit that fatigue, that exertion of 7 or 8 out of 10. And then they take like a 3 to 5 minute rest break. So when you first start teaching women that, they're like 3 minutes. Like, what am I going to do? But it gives them time to recover. It avoids that burnout aspect, like as if we went to a HIIT class. Because when you go to high intensity interval training, there's very few rest breaks. And to get like a true rest break where your heart rate comes back down, probably doesn't happen till the end of class, 50 minutes later. So.
Okay, great. So this is great advice on how to exercise. And but you mentioned protein and that we need to get protein in the body. Yeah. So let's talk about diet before we go back into movement and exercise. Yeah.
So, I used to be vegetarian, vegan, raw foodie. I've done a 40-day juice only cleanse, and I feel better when I eat meat, when I eat red meat. And, for me, my whole focus is muscle. Like we start to lose muscle mass starting in our 30s, and we should really be addressing it then. But, when we're 30, we're not focusing on that versus later. And the amount of muscle we have on the bone is so important later in life, right? Like if we fall and break a hip, which usually the break happens before the fall, the only thing that's going to really save us is the amount of muscle we have in the bone. So my whole focus is muscle. So I eat for muscle, basically. So,
yeah.
I eat minimum 30 grams. And I know a lot of women are like, well, I'm not going to break out a scale. I don't like to track. So to make it really easy, that would be 5 eggs. That would be like if you had a steak, like a ribeye, it's about a deck of cards, that size of a steak. A palm size of ground beef, kind of a handful size of like a chicken breast. So I go by that. I don't track, I don't bring out a scale, but I try to hit that minimum 30. I'll go up to 50 if I've been like lifting heavier and harder. And that helps with muscle protein synthesis. It triggers basically muscle protein synthesis is a fancy way of saying muscle growth in the body. And so I eat protein first thing in the morning. I used to do like coffee and a croissant because it was very New York. And now I eat protein and I eat my protein first in my meal. It's almost impossible to overeat protein. So for people who get snacky or sugar cravings or, do not manage their caloric intake, you eat your protein first. It's kind of hard to overeat protein. It's near impossible. It's very satiating and it helps with muscle. I also eat vegetables, but I know there's like a very large plant-based movement.
Yeah.
I eat my protein first and then I eat my vegetables. And I like there's vegetables in every meal, but I really prioritize my protein because I'm prioritizing my muscle tissue. So,
yeah.
yeah.
This is important because I think that, and especially when it comes to autoimmune diseases, there is a plant-based movement, but we have to realize we need protein to build the muscle, to actually protect our joints, to protect our body from, and, actually provide a proper metabolism
Yeah.
as well, right?
Yeah. There's only, there's certain amino acids that are directly correlated to muscle recovery that you only find in red meat, right? So you could, swap out for quinoa or, plant-based protein sources, but you're not getting your full amino acid profile that's essential for recovery and for muscle maintenance. So, the other thing is if you do switch to a plant-based source, you have to eat so much more of that plant-based protein to get the same amount from a meat source. So if I already have an issue with Hashimotos and underactive thyroid in managing weight, like I don't want to be eating a ton of calories to get the protein source from a plant-based. I'd rather just have it be a nutrient dense source, more protein, less calories. For my body. And, I recommend that for my Hashi ladies. And a lot of the women who start the program, like they're like ordered their kettlebells. They haven't even started the physical lifting piece, but they've changed, because we talk about food and how to eat. They've changed just how much protein intake they've had and they have more energy. And they like drop it in the Facebook group. They're like, oh my God, like I'm waiting for my kettlebells. I've ordered them. I haven't even started lifting yet, but I feel so much better. I have so much more energy. And the only thing I've changed is I've been trying to hit my 30 grams per meal.
Awesome. Amazing.
Oh.
Yeah, exactly. So, but we can also talk about a joint laxity because it's a part of autoimmune diseases. And I know that it's very important. And you're talking about building muscle and getting stronger. And let's talk about how do we help our joints and what is happening in the body with autoimmune.
So this is a clinical observation. This is just from being in practice since 2007 and seeing a lot of bodies every single week, a lot of patients. And, there's not research on this. So I'll just put it out there that this is like my clinical observation is when someone comes to me, they have a diagnosed autoimmune condition, and I check this on every patient. Is like I check. There's certain spots in the body where you can check for joint laxity. For example, the knees hyperextending, the elbows, the thumbs touching to the soft part of the forearm, the pinky bending back past 90. And then if you stand and you bend forward, straight knees, you could palm the floor, which is like every yogi's like dream position, but it's
Yes.
actually too much length in the hamstrings.
Is that true? Okay.
Yeah. It's like yogis, you know, they're kind of like arched, wonder why they have like low back SI joint pain. It's like because you have nothing anchoring you down because you just overstretched your hamstrings. This coming from a yoga instructor who used to teach a lot of yoga in New York. So we check those points, those certain points in the body. There's an orthopedic physical therapy test called a Baton score. And so you add up those points, and if it comes over a certain amount, there's a sign of joint laxity. So I would check this on my autoimmune patients. And it's not 100%, but it's a very high percentage. Like I would say like 85 to 90% of women I would see who already had a diagnosed autoimmune condition, I would check this because they already have joint pain, and, you know, they would have this joint laxity. And a lot of the women, because they have an underactive thyroid, have an autoimmune condition, they already have joint pain. They already feel tight. Their muscles ache, and they feel like they didn't really do much. And they want to get massaged and adjusted. And they want me to tell them how to use their foam roller. And I was like, well, what if we take those things that create more mobility away, because you're already pretty mobile,
Yes.
and give you strength to rein the joints in, to create joint integrity, to create joint stability, because your ligaments aren't doing it because they're lax. And let's see how you feel. Like, let's just do a little experiment for 6 weeks. So a lot of it was like, okay, you're not going to go to yoga for 6 weeks, which I felt like I was taking their soul away, but let's do resistance training 3 times a week. And, you know, probably the first week they felt tight, but did they feel tight because they were now using muscles to create that stability in the joints? And then they started feeling better. Like the joint pain started to feel better. Like their medication didn't change. Nothing else changed except stimulating the muscle, creating some joint integrity, joint stability. And they felt better, like less joint pain, less muscle aches. So that was my goal in the clinic was, okay, how do I teach these women to let go of all the stretching, the release, the mobility that I think is sometimes over-focused. Like if we have pain, like go stretch. It's like, well, what if it doesn't need to be stretched? What if it needs to be stabilized? So giving them that strength routine, and it was just like how I do it in Thyroid Strong. It is low reps, right? Like there's really nothing over like 6 reps, 8 reps. It's not that traditional trainer of like 3 sets of 10 or 3 sets of 15. And then heavier weight. So we start with a deadlift at 2 12-kilo bells, which is about 50 pounds, which, you know, if someone's listening who's a trainer, they're like, that's not much at all. But for someone who's never picked up a weight, might be like, ooh, 50 pounds is a lot. But you need enough weight to create some resistance so the muscles know to, you know, engage.
Yeah.
And then there's certain cues you can give, right? So when you stand and your knees hyperextend, you don't want to do that under load. So you can teach someone to foot dial. You can teach someone how to build tension from their feet up the legs, up to their glutes. You know, teaching a woman how to brace properly, because a lot of women think, oh, I'll just suck my belly in to my spine. But if you do that under load while picking up a weight, you'll actually hurt your back. So teach women how to breathe, how to brace, how to create like a little tank of strength in their core, and then picking up a weight. So that was what I did with women in the clinic to really combat that hypermobility that I saw clinically go hand in hand with an autoimmune condition.
Okay, great. Thanks so much for bringing that up, because I think there is still this dogma, like we got to, oh, if it's painful, I'm just going to stretch it out. And over time it becomes worse and worse. And so strength, the component of strength where our body is protected and kept sort of put together so it can resist the weight. I think this is really crucially important. So I
Yeah.
appreciate you bringing that up. And but like you're saying, okay, so like you had to take away some things from your patients. Like you're not gonna go to yoga anymore, okay? Or
Yeah.
you're not gonna eat your I don't know, fruit shakes.
Right. Yeah.
So there's a component of mindset. Like you kind of have to be really devoted or committed to your healing. Can you talk more about mindset and what role it has in healing?
Yeah. I think with the autoimmune population,
Hmm.
when we are extremely fatigued, our brain doesn't feel like our brain, our body doesn't feel like our body.
Yeah.
I think there's two ways that we show up. And one of the ways is like almost a victim mentality, like my doctor doesn't listen to me, they're not hearing me, I still feel terrible, my meds aren't right. What am I going to do? And I've been there, like I've totally been there.
Hmm.
And like I'm just
Hmm.
going to like lay in bed and just like hope to feel better. And like at the darkest depths of my diagnosis, I did that too. But I was like, oh my God, like day after day, like nothing's getting better. And then I think there can be a mindset shift of, I'm going to keep searching till I find a better doctor that feels like
Hmm.
they listen. Or I keep
Yeah.
searching for a doctor that feels like they put me on medication that I actually start to feel good on. Or I'm just going to do a little bit, right? Maybe it's I do 5 deadlifts and I do an elevated push up off my kitchen counter and I do 2 of them. And that's all I do, right? And you kind of do those like little doses day
Hmm.
by day to start to build that resilience. And sometimes I think there's this cultural message for the autoimmune population of softness, of like, oh, you're tired, like take a break. And I think there's a time and place for that. But I think the opposing message of like, we can do the hard things and we do the hard things in little doses to build that resilience.
Yeah.
So if we start to walk towards that, like those hard things could be not being used to choking down 5 eggs in the morning. So maybe you do 2 eggs. And then
Yeah.
a week later, you add 3 eggs. Are you doing 2 eggs and a chicken sausage, right? Versus being like, oh, I can't do that. It doesn't feel good. I'm just going to like, or doing a like 5 minutes, 10 minutes of resistance training, low reps, heavier weight, long rest breaks, like a thyroid strong style, and building up and not being like, oh, I didn't do, 45 minutes, so I'm not going to do it at all. Like letting go of that all or nothing and knowing that, that idea of like 1% better every day, right? There's that compounded,
Yeah. Yeah.
path. So I really try to instill that into the women that join the program. And the women who do join the program kind of already have that instilled in them, but I just try to accentuate that. Very few people have that desire, the quote unquote motivation to go work out. Even my trainer friends, like they look at a pair of kettlebells and, we'll go to the bathroom. We're like, oh, okay, we'll go take, we'll just find something else versus just keeping the momentum. Like motivation is like trying to get water from a dry well, especially when we have Hashimotos because we are already fatigued and the motivation drive is probably not there. So what if we just do like the little things? We take that mental
Mhm.
rumination out of it. I usually keep my kettlebell somewhere where like I could almost trip over them that I'm like, oh, right, I just go pick them up and do the little things day by day to build that resilience. And if we don't feel like working out, just go do 10 minutes. See if that sentiment of I don't feel like it is still there. 90%
Uh-huh.
of the time, it's gone. So I try to really instill that mindset. Having an autoimmune condition is, depending on where we're at in our journey, can be very debilitating. Like if I am living in a moldy space, it is it's like mean mommy, a whole different Emily than what normally shows up in life. But now I have tools, right? From working with a good doctor, from taking supplements, from
Mhm.
having gone through it before. So if I get into that situation, like I have a toolbox, I have a strategy. It feels empowering. And I know like it's the little things every day, and that the feeling of being in the depths of an autoimmune condition is not going to last forever.
Okay.
Right? And that there's people who've done it and kind of gotten to the other side.
Okay, great. Yeah, I love this attitude. It's just, one step at a time. Don't overdo. Like, I think we live in the extremes in our society. On one hand, like push it as hard as you can, so you're laying in that pool of sweat and cannot do anything else, or just, well, take a break, do nothing because you can't. But there's a middle way, and so takes mindset though.
Yeah, and I think. And I don't know if this is because I have treated an older population. When you see someone who was walking and then stepped in turn and broke their hip, right? Like when people break their hips, it's usually the break happens at the femoral neck and then they fall. It doesn't happen from the fall. And you watch like the surgery and the recovery and the rehab, like 2 hours a day in home, and you see that progress. When you see patients who have to go through that, it just puts this shift of like, I never want to experience that. I don't want anyone to experience that. And I'm going to try and put as much muscle on the bone as I can without pushing myself into a flare up or a total exhaustion so that I never have to go through that. When you start to see your parents, your grandparents age, and some are really resilient and some are like sitting there sleeping all day. You want to be that resilient one that can still experience life and enjoy their grandkids. And I know people don't think about that in their 30s or their 40s, but if you see it, it's just like this like switch goes on. You're like, oh, okay. Like,
yes,
this is my focus.
Yes, thank you so much for that. So, Dr. Kiberd, is there something that you want to leave us with to take away from this interview that maybe we haven't spoken about yet?
I think working with a really great, well-skilled practitioner is very important. So if the current person that they're working with doesn't feel like a partner in their health, keep searching. And even if you have found someone who is more on the functional medicine side, right? Because I had found that originally, a really good practitioner won't treat everything at once. So if there's multiple findings, like, oh, you have a parasite, you have mold, you have adrenal insufficiency, like all these things, they create a hierarchy of what to treat first, right? Like, this is the most important. This has to get dialed in first. Then we're going to tackle this. Then we're going to treat a parasite before we treat candida. So when you find a good practitioner, it will be this journey. It won't be like, okay, like we're going to do 3 months and you're good. They create this hierarchy of protocols and, prepping the gut before you, kill off a parasite. So I think working with a practitioner that does that, because I've definitely worked with kind of the quote unquote functional medicine doctors who treat everything at once, and you're taking like, a lot of supplements. I already take a lot of supplements, but you're taking a lot of supplements and you don't feel better. So I think work with a very well-skilled practitioner and have them feel like they're a partner in your health. Like if it's like 5 minutes in and out, it's hard to take a life past health history in that time. Maybe search, be like, stay curious, like search for someone better.
Yes, thanks so much for that. And just be your own self-advocate because, we know our body. We are the experts in our body. That's what I always say, and you need help from others to, put things in right order. And also what you're saying is that if we cannot treat everything at the same time, it is a progression. So that I think this is very important to remember that. So Dr. Kiberd, how can people reach out to you, learn from you, connect?
Yeah, so it is Dr. Emily Kiberd across all the social platforms and website. Programs called Thyroid Strong. So yeah, pretty easy. Okay. And anyone can DM me. I respond to all my emails, all my DMs. So.
Okay, great. Okay, so we'll put all your information out there. So if anybody feels like they may be having an issue with Hashimoto's or are identifying themselves about with what we've been talking about, reach out and at least start learning, get yourself on that journey.
Yeah.
Well, beautiful. Well, thank you so much for bringing all this wisdom and information today, Dr. Kiberd. I really appreciate it. And I appreciate everybody coming on the show again. Come on back because we have outstanding experts speaking with you. And we want you to be getting all this information. So thank you, everybody. We'll be talking soon and have a beautiful day. Okay. Great. Good.
Great. Thank
How was
you.
that? Did you feel like you're able to